Right, well, hello everyone and welcome to this afternoon's event, and thank you for taking the time to join us. By way of introduction, I'm Simon Darby, Director at the Public Affairs Agency PLMR, and I act as a policy advisor to NOAA. And it's a genuine pleasure to be chairing today's session. We're delighted today to launch the NOAA Livestock Vaccination Guideline, which provides vaccination guidelines for the dairy, beef and sheep sectors. The guideline document will be available on the NOAA website immediately after this event finishes, so you'll be able to peruse it at your own leisure. We have a great lineup of speakers today, including the authors of the document, Jonathan Statham, Henry and Fiona Lovatt, who will offer their insights and thoughts shortly. We should hopefully also have time for our speakers to take questions at the end, so please do submit questions into the chat function and we'll try and get through as many of those as we possibly can. We've got a packed agenda today, so rather than listening to me prattle on, firstly, could I invite Dawn Howard, NOAA Chief Exec, to say a few words by way of welcome, followed by Grace O'Gorman, NOAA's Senior Technical Policy Manager, who will provide some context into the initiative and today's launch. So over to you, Dawn.
Great, so thank you very much, Simon. And a warm welcome to all of you joining and to our presenters today, including the authors of the Livestock Vaccination Guideline, Jonathan, Joe and Fiona. So great to have you with us. I think there was a slight delay with Joe coming in, so I hope that he's been able to join us. For those of you who may not know NOAA, we are the leading trade association representing the animal health sector here in the UK. And our vision is simple. It's to be at the forefront of UK animal health and welfare. And the launch today of this vaccination guideline is a fantastic example of how we're contributing both practical tools and new strategies to improve the health and welfare of our livestock. Grace will speak next about how this work sits in the UK context, but it's also worth looking at the global picture too. And here there are many examples of complex challenges, including access to veterinary care, cold chain storage and regulatory barriers. Nevertheless, vaccines remain a vital tool to control and prevent disease, to protect public health and help reduce the environmental impacts of livestock. And whilst we as an industry work to develop more innovative vaccine solutions in the future, we also have an opportunity to make the most of the great vaccines we already have available here. So now I'll hand you over to Grace. And hopefully Grace is coming up.
Yes, hello everybody. Thank you. Thank you very much, Dawn. I'll just share my screen here with you and bear with me. Thank you very much. It's absolutely fantastic to see so many of you joining today from industry right across the food supply chain and government, and I think it not only reflects the huge amount of interest in improving animal health and welfare, but also the huge range of activities that are ongoing at the minute right across the UK. And we're doing our part here at NOAA. We're delighted to be able to launch the NOAA Livestock Vaccination Guideline today. And this really builds on our previous work around developing agricultural policy that's fit for the future and on our farmer training in the responsible use of antibiotics. So today, before we hear from our authors, and I'm really interested to hear their perspective, I thought it would be useful to give you a little bit of context and background to this paper. There's lots of challenges to livestock production. I'm sure you're all very well aware of them, but there are reoccurring themes in terms of priorities that are coming up now time and again. We know we need to improve efficiency and productivity, but it's pretty clear we need to do this in a really sustainable way. And looking at the wider global production of food and supply, it's asking us now to challenge our ideas around if we're resilient enough and can we supply food in a safe, nutritious food in a secure way. And of course, the backdrop in the UK is around adapting to agricultural policies. And we're seeing more and more there's an incorporation of the environmental standards in there and achieving good environmental outcomes. And at the heart of those is concepts around One Health and linking the health of animals, people and the environment. And what we're really interested in, of course, is improving the health and welfare of our livestock. There's lots going on, as I mentioned. If we look at industry and the work of the Ruminant Health and Welfare Group and everything that they're doing, and also looking at DEFRA and the Animal Health and Welfare Pathway, I think there's really a renewed interest in working on endemic disease to drive down mortality and morbidity, to reduce food waste and ensure farmers are profitable into the future. So we know sustainable food production really starts with healthy animals. And producing and looking after animals, of course, involves lots of different elements. We need to take a really holistic approach to this. We can look at nutrition, husbandry, biosecurity, and vaccination really sits at the heart of that. It doesn't sit alone. It's part of a bigger picture. But we must ask ourselves, how well is the true potential of vaccination really been harnessed? And how can we improve on our current approach? And this really is the question that requires a fresh and challenging review of our current practices. And that's exactly the challenge we've put to our authors here today. And they've been working hard on producing vaccination guidelines and policy and practical tools to use with vets, SQPs, RAMAs and farmers. And really, they will go into a little bit more detail, and I'm really interested to hear what they have to say, but they will set out their views on what that should look like. So what could a progressive livestock vaccination strategy look like? Well, I will challenge you to think about population level medicine and how do we achieve the real benefits of that also work on individual farms. Well, we've put together a livestock vaccination categorization tool that allows you to look at category 1 and category 2 vaccinations. And those category 1 vaccines could be described as opt-out vaccines, considered as default. And when those conversations between vets and farmers regularly occur, you could challenge yourself to ask why not vaccinate in those cases. So that really sets the scene and will be added to in our follow-up presentations with our authors. But of course, you might be asking yourselves, well, how can I use these tools and what's going on in industry and how does the whole thing fit together? Well, I've picked just 2 examples, primarily because they've had really recent successes and activities. And the first one is the Ruminant Health and Welfare Group have produced this fantastic report, Acting on Methane. If you've not read it, I would highly recommend you do so. And it's really the response from the livestock ruminant sector about, well, what can we do in terms of the methane pledge and reducing by 30% by 2030. And it sheds a light and focuses on the fact that actually delivering improvements in animal health can be part of the solution. And so this vaccination guideline can really fit in and contribute to all of the tools available across the sector in delivering on that. And secondly, I want to mention Farm Vet Champions. Fiona is with us today and she will mention this. She's the clinical lead, fantastic initiative, has lots of CPD for vets and very recently, only last week, launched their own Smart Goal platform. And within that, as one practical example, vets can actually set their own goals. And with one of them, you could choose to use the vaccination protocol. So very practical examples of how we can contribute to industry initiatives. But of course, we work in a broader sphere and with government, and there's a lot going on. So it's really encouraging if we look across all devolved nations. There is a theme, strong theme coming out about the importance of animal health and welfare. If you look at DEFRA and the Animal Health and Welfare Pathway itself and the annual health and welfare review, this is clearly a tool that can be used to support vets, farmers and RAMAs in those conversations. And for a long time in Wales, we've had a prevention is better than cure mindset and approach in terms of their animal health and welfare framework. And so that fits very much in the same way of thinking in terms of this guideline. And the Scottish Government have set out a vision to be a leader in sustainable and regenerative farming. And again, within that, they have outlined that animal health and welfare plans are a really important part of it. And in Northern Ireland, we've got future agricultural policy under development that also recognises the fact that we've got to be productive and efficient, but we must think about it from a One Health perspective. So I think you can appreciate from a government perspective and from an industry perspective, there is actually a lot of joined up thinking about these priorities, and there are very ready ways in which we can all get behind this and implement the Livestock Vaccination Guideline. And finally, I want to thank Lord Benyon and also his team at DEFRA, who have been very kind in terms of writing our forward and also pledging their support for this initiative. And I think it's particularly fitting as Lord Benyon has biosecurity in his portfolio, and of course vaccination is such an important part of that. So I thank you very much for your attention, and I will hand you back to Simon.
Thank you very much for that, Grace. We'll now move to the main authors of the report. We've got three, as I mentioned at the outset, in Jonathan, Joe and Fiona. So first up, Jonathan Statham, author of the dairy section. Jonathan has more than 25 years of experience in veterinary practice with a range of wider industry and academic roles. He's the Chief Executive of Raft Solutions and Chair of Bishopton Veterinary Group. He remains active in practice as an RCVS recognised specialist in cattle health and production. He's past president of the BCVA, professor of sustainable livestock health and welfare, and is currently the chair of the Animal Health and Welfare Board for England. Easier for you to say than me, clearly. His main veterinary research interests include progressive herd health, reproductive technologies, and precision livestock farming approaches to sustainable food. So, Jonathan, over to you.
Thank you very much. Just checking, has that shared okay? Is that all right, just in terms of slides?
Yeah.
Excellent, very good. Well, first of all, many thanks for the obvious invitation to be both part of the launch today. I'm really delighted to be part of this, and also to be part of the whole process with my co-authors and obviously the kind of editorial team. Grace has kind of herded us all in the right direction, because this is a really, really important initiative. I think it's hugely important time, and yes, so the last sort of 26 years I've been kind of proud to be part of the livestock industry, and obviously specifically talking about the dairy industry today. I've enjoyed and been very privileged to be part of lots of aspects of the bigger picture of the dairy industry, both regionally and nationally and internationally, and looking at how important it is to produce milk sustainably, to understand the kind of core role of herd health right at the centre of the whole of kind of sustainable dairy production. And so I've been really kind of proud to have a range of roles within the industry over a number of years that really have been looking therefore in that kind of longer term joined up way. But fundamentally, I'm a vet in practice, and I'm still a vet in practice, and I've been out on dairy farms all day today. It's been fairly warm actually up in Yorkshire, so under waterproofs it has been quite a warm day for doing dairy herd health today. But it makes me realise every day the central importance of this vaccine guide, and being part of a kind of practice approach and practical approach to really what the dairy industry is all about. Because the dairy industry has got a key role in society globally, but also on a key role on a national basis. It's a really vital part of our culture, a really vital part of actually how we produce balanced food, and a really vital part of how we interact with the environment. And so what I do want to talk about is just follow up briefly what Grace touched on, was that as a vet in practice in the last 26 years, I do think my day-to-day role has evolved a bit, in that I do feel now, and all these slides really come from the guide, so you'll be able to pick up and read more about these things that I'm going to pick out here because they're contained within the guide. But I feel that my role now as a vet on farm within a team is about balance. It's about very much looking at animal health and welfare. As a vet, that's still really where my home territory is, understanding how to support the health and welfare of dairy cows and calves and all of the associated groups that are under my care, and look after them. But actually not to lose sight in this hugely changing world that we've got about the importance of food security. I don't think any of us need reminding how important food security is at this moment in time, and the dairy sector provides massive aspects of that. in terms of high quality proteins, also supplying obviously kind of dairy beef into the beef sector as well, but also this whole idea of interacting within that whole food system in the circular economy as well is really key. So I think food security is really vital, but at the same time, therefore, understanding how livestock and arable systems and the land interact so that we can actually have obviously healthy soils and water, also look at energy security, but also maintain biodiversity, because our customers expect that we will manage the environment as well as managing our livestock producing food. And last and definitely not least in this balancing act is actually looking at our responsibilities for One Health, looking at antimicrobial resistance, looking at responsible use of the tools that we have to look after health and welfare of animals, but also looking at the tools that we've got available for prevention, and therefore prevention being the overall driver in terms of herd health in this approach. So some examples, therefore, looking at bringing those things together, we have got this huge responsibility to provide for food security, but also to do it at the same time as our customers and society expects us to consider the environment as well. And there is no bigger win-win than reducing the waste of disease. If we can produce food and we can do that efficiently and effectively with high animal welfare, actually, if we've got really good health, then we reduce the waste that's associated with discarding milk in cows that have been treated, in reduced production and output because animals aren't well, but also in understanding the wider effects of actually producing food in a way where we use nutrition effectively and feed inputs effectively too. So we've got really big opportunities, and some of the work I was involved in presenting at COP25 a few years ago now show that actually controlling key infectious diseases like BVD through vaccination in the worst 10% of herds, actually that alone can reduce warming potential by around 11 to 12% in UK herds that were part of this study. So just one single health action on its own, supported by vaccination, can have a big impact on that sustainable food production. And if we look across the top 10 endemic diseases of cattle and of dairy cows, if we look at the trade-off, the win-win between cost-effective return on investment as well as a return on kind of carbon mitigation, if we just look at how many of these actually include vaccination. So IBR vaccination, Salmonella vaccination, BVD vaccination, pneumonia vaccination are all included in this list of kind of key priority dairy diseases and the approaches to actually reduce the impact of them. So as Grace said, I think a key part of herd health discussions between the farm team, which is vets, farmers, and obviously the wider team, is around why we should use vaccines and why we should actually select vaccines as part of a joined up herd health approach to herd health management. But as Grace said, perhaps actually what we've really got is a fresh look at this, which is to say, why not vaccinate with certain kind of key priority diseases and conditions? And this perhaps has really been brought home when we look at our approach to kind of COVID-19 and therefore the key role that vaccinations played. We have to ask the question, and there can be reasons why not, but we're asking the question, why not vaccinate in key circumstances? But if we look at some of these like key category 1 vaccinations, and Joe and Fiona are going to pick up obviously on the beef and the sheep, but I think we're really asking the question here, and this is all within the guide, where we look at why not vaccinate against BVD, why not against IBR, BVD, but also against lepto, bovine respiratory disease and diarrhea in calves. Why not? There needs to be good reasons. So I think we perhaps can look at the range of vaccines that are available out there and perhaps split those into two kind of key areas. So we've got these two categories, vaccines where the question perhaps is why wouldn't you use them, and a set of category 2 vaccines where actually if there's an indication for the farm, then they should be part of that herd health strategy. But we can perhaps also break these key dairy conditions into two main areas. So single agent diseases like IBR, like BVD, like lepto, where they don't respect kind of well-managed herds, and boundary breakdowns can bring these diseases in. So these are really key diseases where vaccine represents a really key part of control and prevention. And that's going to be important for trade in terms of understanding our status as a trading country, but also they're really important in terms of reducing waste, both in terms of food security and the environment. So these big single agent vaccines, and you can read obviously more about that in the guide. Again, a second category though is perhaps these slightly more complex management or multifactorial diseases, which might be a complex of challenges from respiratory disease or diarrhea or mastitis. But in this area as well, in the dairy sector, we're fortunate that we've got a range of really important and effective vaccines that can help manage those conditions. And therefore, we've got multifactorial vaccines, which are a really important part of dairy herd health too. Rise again, and these things are very much in the guide. The category 1 vaccinations, therefore, really are all around these kind of key kind of single agent diseases first with BVD, IBR and lepto. But also the question would be to say, you know, why not have that conversation about why would we not use respiratory vaccines on a unit? If the answer to that, because of an evidence base, is because actually things are going really, really well and the environment management is great, then that's fine. That's part of the herd's overall bespoke plan. But asking that question, and the same for calf scour, is really important. It should be a consideration in our view. In the same way, the category 2 vaccinations on certain herds will be absolutely critical to use, because on the basis of that farm team piece, they will be very, very important. But we're just arguing that actually this needs to still be a bespoke process between vet, farmer and the farm team. And actually, if there is strong evidence, of course, these vaccines are really important too. So just to summarise, Grace, I just want to draw this together to say that, you know, poor health and subclinical disease are a big form of losses, and therefore a really kind of key opportunity for improvement, both in food security, but all aspects of sustainability. As Grace said, the animal health and welfare pathway in England is basically going to be coming, you know, out to all farms later this year, and linking up obviously with initiatives in you know, different kind of nations as well. It's going to be really important to say, can we make sure that vaccination is a key part of the considerations in taking the opportunities for improved health and welfare and sustainable dairy production in all those countries? I'll leave it there, I think, Grace, if that's okay, just to say that all this is in the guide, and thank you again, Simon.
Thank you very much, Jonathan. That was incredibly insightful. Moving on to Joe Henry, who authored the beef section. Since graduating from Glasgow in 1998, Joe's worked as a practicing vet in Northumberland and New Zealand, primarily with suckler and sheep clients, focusing on preventative medicine, production KPIs and grazing management. He is an RCVS recognised advanced practitioner. In 2018, he undertook a study tour to large cow-calf operations in Western USA. And Joe also runs a farm with his wife, Rachel, including a good Lewing-based herd of 100 cattle. I hope I've got that right, but I may have exposed my lack of detailed knowledge there. Anyway, Joe, over to you. You're on mute there at the moment, Joe.
Can you hear me now?
Yes, all good.
Yeah, all good now. Great. Well, thanks very much for introducing me, Simon, and thanks to Noah, really, and especially to Grace for pulling this together. I think it's been pretty timely. We've all seen the benefits of vaccination, and we've all lived through it, and seeing how vaccination can reduce the impact of disease with the COVID-19 situation. I think, you know, drawing some parallels from there, the more we can reduce the impact of disease, the better, really. So this guide, looking at the beef vaccination strategies, one of the main difficulties was the fact that beef cattle in this country run in such varied systems. from sort of small hairy cows in the hard hills, heather and bracken and stones, and they're basically generating quality protein from land that essentially isn't good for producing anything else for us to eat. To the uplands, where the cattle are there to help manage grass for sheep, as well as eat intestinal parasites that affect sheep, and also help with that carbon sequestration with the grassland, right down to the lowlands, where there'll be part of an arable rotation, maybe, where the land is in grass for a number of years to build the fertility before going into crops, without having to put too many inputs into that, so making the cropping a bit more sustainable. So and then finally there's the sort of the really intensive using byproducts inside systems. So you can see, that it's quite tricky to have sort of common denominators across that spectrum, but we've pulled out a few for these category ones, and I think that is an important thing. It's basically for those category one things, is the default position is to use them, and unless you can good reasons to opt out. And I think that's the sort of the different in mindset, really. We need to get a bit better at that, I think. I mean, BVD vaccine for the cows, 43% of cows are vaccinated in this country, really, and it should, there's not many places, there's not many beef farms on islands with no sheep, and that's the sort of thing that really should be pretty much default. So going back to reducing the impact of disease, the great thing about reducing the impact of disease is there's so many wins. There's the improved welfare for the animals. Obviously, it's better if they don't get poorly. Improved health of the animals because they're not getting poorly, and particularly for the farmers, they'll be really pleased at that. But also, if they're not getting poorly, then also they tend to be performing better. And so in the beef industry, it's all about producing kilos of beef, and they'll be growing more efficiently. The big impacts of disease, for instance, pneumonia in calves, RSV outbreaks, the big cost to the farmer of that isn't so much drugs to treat it, or possibly even having dead animals. It's the fact that he's keeping the animals alive and they're not actually putting on beef. So typically in an outbreak of pneumonia, for the first week, those cattle will lose weight. They'll then stand still and not gain any weight for a fortnight, and then the fourth week they'll go back to where they were at the start of the outbreak. So the farmer's been feeding those animals for a month and getting no return, and obviously that's expensive for the farmer in terms of financial costs. And also what we've got to be really aware of now is actually all those inputs will be coming with a cost environmentally from a carbon point of view. So there'll be a cost financially and actually a sustainable cost in terms of greenhouse gas emissions, where no output to ameliorate them. So, I mean, it's pretty difficult for our beef farmers to make profit, even the ones across the hill in Scotland there who are getting the beef suckler premium, £100 a calf. These investments in animal health to reduce the impact of disease are much more likely to help the farmers then generate profit by improving that output of kilos of beef, either through helping growth rates, or in the suckler cows, fertility is absolutely key. It's the cornerstone to productive beef herd is to be able to rear calves. And if your cows aren't getting pregnant, or if they're aborting calves or not having live calves, that's going to really impact your output, which means the costs that you do have are spread over fewer kilos of beef. And that's where things like the BVD and the lepto are sort of pretty much mandatory. We've come to those decisions. Clostridial disease, because nearly all beef have part of their life cycle, lifetimes outside of grass, where Clostridial spores are ubiquitous. I think really they all have a really important part to play, Clostridial vaccination, and pretty much across the board, all cattle that ever go out to grass should be vaccinated for Clostridial, whether calves, yearlings, fattening cattle, or cows, really. For calves, the RSV vaccine, RSV is virus that affects, basically it can affects the respiratory tract and can be sort of the opening to other respiratory pathogens, and certainly that's the most common one that affects suckle calves, and I think they should be vaccinated before periods of stress when they tend to get pneumonia, so be that housing or weaning or both even. Bigger cattle tend to have less problem with RSV and much more problems with IBR, especially if they're moving farms and they're meeting. Facts with the beef fattening industry is that there's sometimes farms that will grow on calves and then sell them to another farm who will maybe finish them to take them to fat, or there might be 2 farms in between, and each time they mix the different populations, and IBR certainly can be important for those classes of cattle. So those are really, that's all I really wanted to say. You know, it's all there in the guide there, and I don't know if you guys want questions now or later. I think Simon alluded to that. I'm happy to take them.
Brilliant. Thanks very much, Joe. Yeah, I think we should have about 20 minutes at the end for questions, so I'm sure we'll be coming back to you on that one shortly. But thanks very much for that. Now time for the final of the 3, but sorry, last but by no means least. Fiona Lovatt, who is the author of the sheep section of the guideline. Fiona is a European recognised specialist in sheep health and production, a clinical associate professor at the University of Nottingham, and a past president of the Sheep Veterinary Society. She runs the sheep veterinary consultancy business Flock Health. She is a clinical lead for the RCVS knowledge-led initiative Farm Vet Champions, as well as the sheep veterinary member on the Rumour Target Task Force. She's particularly passionate about getting proactive veterinary involvement on UK sheep farms, particularly infusing both vets and sheep farmers to interact better through proactive individual flock health planning and flock health clubs. Fiona, the virtual floor is yours.
Thank you, Simon. I think that's sharing okay, is that correct?
Yes, yeah, it's all fine.
Okay, thank you. So I thought I would just start. UK sheep industry, we're quite used to, in the sheep industry, being second class to the cattle industry. We actually have a really significant sheep industry in the UK. We are the largest sheep producer in Europe and net exporter. At any one time, there's at least 15 million breeding ewes, and their lambs on top of that. So we have 70,000 sheep farmers in the UK. And actually, in terms of globally, and we're talking about food security, small ruminants are extremely important in terms of feeding the world. So there we are with sheep. What is good sheep farming about to UK producers, to any producers? It's about producing quality food, managing the land sustainably, and operating a viable business. And where do we fit into this as vets? Well, we are an essential part of that farm team, and that's not just health and welfare of the sheep, but the health, wealth and welfare of the shepherd, and that's through productivity and performance of the flock. And preventative medicine is hugely important there. We are not just about treating sick animals, and that's because, as both Joe, as you've described already, disease costs. So the disease costs in welfare, in finances to the farmer, to the industry. In terms of medicines, if we have sick animals, we have to turn to treating them with medicines. And actually, we want to prevent them being sick in the first place. And of course, there is an environmental impact. And I think it's something like 20% of disease has a massive impact, as Jonathan explained very clearly, on sustainability and the kind of cost to the environment of disease. When we look at it in an individual flock, our main cost to a sheep flock is usually the replacement ewes and it's feed. But the thing that farmers always complain to me about is the better med costs. And we can talk about a bad vet spend. So any time we have to treat an animal, or we have an animal that's sick,
or dead or not growing properly, that's a bad cost. We do not want to be spending that money on vet and meds. And I would put antibiotics in that category. We don't want to be treating ill animals. Good ways. We don't want to reduce vet and med spend to nothing. It's really important to be spending on the vet and med part of the bill, and that's a wise investment. We want to be putting in good preventative measures, and that can be in flock health planning. That's protecting the flock, and vaccination very much comes into that. So just the sticky plaster is treating sick animals, and actually we need to be planning ahead, we need to be preventing disease, and we need to have the animals protected in whatever way. And apart from the cost of the flock, we also have to have flocks output, maximum output, and there is an important difference between the potential of a flock, and it's not always just the maximum numbers of lambs. There are certain, we have such a beautifully stratified industry in the UK. We don't want every hill ewe to be producing 2 lambs. That's not sustainable for the land. There's a potential of the flock is the optimum for that flock in that position. But what's really important is the difference between the potential of the flock and the reality. And whenever I speak to a farmer and ask them, what their lambing percentage is, they will always tell me the scanning figure, which is the best number. It's the most impressive. Actually, what I'm interested in is what the reality is for that flock and how many lambs are sold, and the difference between the potential in the flock at scanning time. There are always less lambs born, there are always less lambs turned out of the shed, there are always less lambs weaned, and then by the time the sale comes, there is a certain amount of wastage and lost potential, which on very good farms, maybe 10%. Often when I'm setting targets for people, we're aiming for 14% wastage from scan to sale. And I am afraid I've seen farms where it could be 30 or 40%. And what's causing that loss is it may be abortion, it may be deaths, it may be, there's various reasons why the potential in the flock isn't what's actually sold. And the important thing is that if a farmer is scanning at over 200%, so he has a lot of ewes that are have triplets inside them, he is having to feed those ewes, he's having to treat them with more costs and more tender loving care up to the pregnancy. He needs to bring that back, and that has an environmental cost, and it has an actual physical monetary cost to the farmer. If he then turns that ewe out or sells 1 lamb off that ewe, the farm can't afford that. That inefficiency is really, really important. So as we're maximising the lamb output from a flock, every lamb does count. So we do want maximum lambs born, and that's probably optimum lambs born for depending where they're from. We need those lambs to keep growing, we need them to be thriving. We need the ewes to be in optimum health. We know the best time for a lamb to grow is the first 6 to 8 weeks. That's the key time for knowing whether that lamb's going to be one that has few days on farm, gets off quickly, has lower environmental impact, and makes more money to the farmer. The ewe has to be right, she has to be milking well, and those lambs have to sell. A dead lamb is no good to anyone. It's got to be fit and healthy and sell at a good time at a good price. So a flock that is robust will do absolutely anything it can to prevent jeopardising that health and productivity. We can't afford unnecessary loss. Our sheep farmers are hugely under pressure, and loss of efficiency is something that none of us can afford. So that it turns us again to planning ahead, preventing disease and protecting the flock and herd. So when we go to the guidelines, and talking about sheep, we're talking about category 1 vaccinations, so the highest priority, and these are the ones I would consider to be a default in sheep flocks: Clostridial and Pasteurella, Clostridial disease, pasteurellosis, and then lameness, foot rot, and the abortion vaccines. When I say that they're high priority and they should be the default, it does not necessarily mean that every one of the flocks I work with vaccinates all their animals for all of these diseases. But what it does mean is that what I strongly feel that every flock that does not have good veterinary advice should certainly be using these vaccinations. So as a default, use these vaccinations. If you're getting good veterinary advice, you as a farmer, or you might have discussed why there's a category of sheep that, for whatever reason, that it may be that their welfare or their productivity, that you can justify why you don't vaccinate them. But that does depend on having good contact and engagement with a vet. So it's actually a different way of thinking. And if a flock does not have good veterinary advice, then there is no excuse. You have got no defence. They should at least be vaccinated and well protected. So I'm so excited about this vaccine report. It's brilliant. Vaccination is so important to us for all those reasons that Jonathan and Joe have already described. And in the Farm Vet Champions that Grace mentioned at the beginning, where this is looking at specifically good use of medicines, and I've explained this before, encouraging vets and farmers to plan ahead, to have a plan and to prevent disease. And preventing disease could be making sure the environment is right, making sure that animals are fed well, they're in good body condition, they don't have drafts, they're well bedded. Preventing unnecessary disease, it could be poor hygiene in the lambing or the calf shed. And then protecting the herd or flock, that is colostrum to the neonate, but it's actually vaccination to the adults, and that vaccination is a key part of that. So I'm just going to end on this slide because I can't not have an excuse and not have an opportunity just to let anyone who is involved with veterinary surgeons, veterinary practice, a huge amount of work has gone into encouraging vets, all livestock vets in the UK, to use antimicrobials responsibly, and there is free learning there. Please don't let it go to waste. And the vaccine report, the vaccine guidelines, we've got this capability now within our platform for vets and their practice team to set smart goals, to actually look at where they are, what would suit their practice, their clients, and actually log goals and then track themselves and keep each other accountable. And sharing the vaccine guidelines with clients is just brilliant.